The other criticism was that it would cause oxalate kidney stones. Well, no one has ever been able to come up with a series of patients showing that it would cause oxalate kidney stones. Believe me, that would be an easily published article if anyone would be able to do that, and they haven't been able to do it. Well, but then the question is, why is it that ascorbate doesn't cause oxalate kidney stone? Because it's quite true that those of us who take ascorbate have high oxalic acid in our urine. Like my oxalic acid in my urine is 3 times normal, but no kidney stones. Well, it turns out that if you section a calcium oxalate kidney stone, there is always a nidus of infection in the middle of it. Now they're saying it's a nanobacteria. And the stone grows around this nidus of bacteria like a pearl grows around a piece of sand in the oyster. And so the thing is that we may have the most expensive urine in town, but we also have the cleanest urine in town, is that the ascorbate being spilled in the urine when you take large amount is sterilizing the urine. And in fact, some urologists are beginning to use this in people who have to have indwelling catheters all the time to keep them from getting infected. And so anyway, that seems to be the reason why we don't get kidney stones. I've given over 30,000 people massive doses of ascorbate since 1969, and I have seen 1 or 2 cases of stones, but they really weren't taking the high doses, and out of 30,000, I don't think that's very many. And as a matter of fact, at least in one of them, what we did was to up the vitamin C and give them B6 and zinc, and then they didn't, B6 and magnesium, and then they didn't have any more kidney stones. Adele Davis years ago had talked about how oxalate kidney stones resulted from a deficiency of B6 and magnesium, and we have found that to be true and a good treatment for these things. But I do say that people who take massive doses of ascorbate should drink a fair amount of water, and you should never become dehydrated when you're taking massive doses of, because you might actually get oxalate crystals in the urine. But there you won't have trouble as long as you drink a lot of water.